Some of these products are the antibiotics, benzoyl peroxide, some of the other topicals may work on one area. They'll kill, the clindamycin will kill the organisms on the skin. They won't affect the inflammation, they won't affect the sebum production. The benzoyl peroxide, same type of thing. You get a lot of different products that they'll work on one item. So you're treating one area of the acne and not treating cause. And the cause are three different areas. You want to treat the bacteria, deal with the sebum production, and the irritation and inflammation that the sebum then causes. If you don't treat all three, you're not going to get quality resolution to the acne. So our products, we work on all three areas, so it's not treat one and let the others go, or having two or three multiple products to treat one individual. All of our products work along the line, and they all work together to treat several different functions. With our, well, you're going to get a little commercial, and then we'll go back. We'll go back. So sorry, guys.
I did it. I'm sorry. I'm sorry.
Yeah. Our products are very safe. We don't use the harmful products. We never have. We never will. We team with you. We work with dermatologists. There's dermatologist employee in the room today. That's fine. We work with dermatologists. We work with aestheticians, and we work with a lot of plastic surgeons as a team. We don't sell to the public. We don't work with the individuals. So we work to give you the education, you the expertise. We're available to be the team member on this, so you become the acne expert in your community.
Okay, now you're stuck with me again. What I did was just give you a quick synopsis of an easy way to cure acne, and that is we can reduce dihydrotestosterone, which then does reduce the sebum production. And that's what Larry said is one way of treating it. We can reduce the free fatty acids, which removes the irritation, and that's another aspect of acne. And we can reduce P. acnes in the skin, and we'll talk about how to do all of those today. I developed the products, and in developing the products, I went back to where we started today. We have P. acnes, we have 5-alpha reductase, we have this, we have that going on. And I went to the internet and did research for a couple of months on what natural ingredients or minerals had an impact on these various biochemicals that are involved in acne, and came up with a list. What I did from there was take the things that most commonly would treat multiple aspects of it, and those became then our list of ingredients. So we take the things that will not only kill acne, but will also affect 5-alpha reductase, will also affect inflammation. Our key ingredient, one of the key ingredients, is called cinnamon bark extract. And it comes from pure cinnamon bark. It's not the kind that you find in the bottle at the grocery store, but it's a cousin to that. Cinnamon bark extract very effectively reduces the influence of 5-alpha reductase. So we're not going to affect the ability of that chemical, that biochemical throughout the body, but on the skin and within the follicles, we're going to make that chemical incapable of being the catalyst that it normally would be. And it just sits there in a more inactive phase. So normally when we would have more acne, we can add cinnamon bark extract to it, and all of a sudden we end up with less dihydrotestosterone. Less dihydrotestosterone means less sebum, and that means less acne. So from the very beginning, we have sort of slowed the progression and made sure that the sebum production doesn't happen. We put that ingredient into two products. One is antibacterial cleanser, and that's for normal to oily skin. It's a cleanser. And the other one is acne inhibiting gel, which is for people who have moderate to severe acne. About 1% of the population, however, cannot tolerate cinnamon bark. And those people would end up with red, irritated skin. So we had to offer an alternative to it, and we'll get to that in just a little while. So it has great potential, but it has limitation in 1% of the population. I think you're probably already familiar with cinnamon bark extract and its Now we'll go to the more generic areas. What are they using to treat diabetics that is not a drug, do you know? Yep, cinnamon, that's it. Anybody know anything else they're using cinnamon for? Pardon?
Sunscreen, isn't it in sunscreen?
It can be in sunscreen. It's a perfectly natural sunscreen. Could be there. Cinnamon is very much in research right now because they're finding out that it's very bioactive. It does a great deal in the body. It controls, in working for diabetes, it controls insulin production. You know that insulin is a hormone. Okay. So we're finding now that they're looking at it as a controller of hormones within the human body. So it's a good product, it's a good ingredient. People will recognize that this is a legitimate ingredient that has some significance to it. I'm sorry.
I was going to ask, would you recommend that as an internal for people to take as well as being on a treatment line?
The trouble with internals, and you're going to find mixed reviews, the skin is sort of at the end of the train.
Okay.
Yeah, so things don't get there. We keep harping. In the case of, I will harp, pardon me, I'll harp, about eating antioxidants, but I only harp because if you put a load in, granted, parts of it will be stolen, but there still may be enough residual to get to the skin. With cinnamon, it just isn't going to get there.
Okay.
So it's a great thing to have your customers take, knowing that that's not going to be the solution, but it can be an augmentation to the solution. We looked at other things, though, controlled 5-alpha reductase. Not surprising, green tea came to the top of the list. And I don't have to tell you all the other things that green tea is used for. It's a wonderfully bioactive ingredients. Turmeric. Turmeric is contained in seasonings like curry, and India has often been marveled as an area where cancer doesn't exist. And it's attributed to the curry that they eat. And actually we use turmeric and we use curcumin, which is a specific part of it. Zinc inhibits 5-alpha reductase. So these are 3 additional ingredients. We put these ingredients then into the other cleanser, so that you now have a cleanser that is cinnamon bark, and that's for oily to moderate acne, oily to moderately oily skin. And then we put it into bacteriostat, these ingredients into bacteriostat, because it's non-irritating, and this cleanser now is for dry skin or mature skin. And as Laurie mentioned, we're finding a lot more mature acne, and you're probably treating a lot more adult onset acne because they wonder what's going on with their skin. And that takes us back to eating, which we'll get to. We also put it in the follicle clearing lotion. We put it into the green tea clay poultice and a number of things. So we covered the base everywhere with it. One way or another, we're going to inhibit dihydrotestosterone from existing in the skin or existing in any abundance to the skin. So our approach to acne then has been to block acne, not to treat bacteria, but to actually block acne. And it was as a result, with Vion products, you will be able to control 90% of acne patients who walk into your studio, your office, your clinic, or whatever. And that control will happen within approximately 3 to 4 weeks.